so we're here today, we're going to do a little bit of filler just to this area. It tends to, over time, get a little bit heavier down here, so we just like to restore the balance of having a slightly broader cheekbone and narrower jawline. And by putting some filler in this area, you can lift the cheek up and back. We only put a little bit, so it looks very subtle. So we'll get started. I'm going to wipe the numbing gel off. Typically we numb for this area with topical numbing gel for about 15 to 20 minutes, not very uncomfortable. And then I'm just going to clean the area with an alcohol prep. Okay, so you can rest your head back and then turn all the way. Perfect. So sometimes if you want to see where the skin tends to buckle, if you pinch the skin, you can kind of see where the volume loss is, just right there. And that's what's causing her very subtle downturning of the corner of her mouth. So we're going to use the cannula in this area because the cannula allows you to do less number of pokes, which in the end leads to less risk of bruising. So first we're just going to put a little numbing dot. 1, 2, 3. The filler that I'm using is in the hyaluronic acid family of fillers, like the Restylane, the Juvederms. Today I'm using Restylane D-Fine. It's a great filler for this area because it's very flexible, so it will look very natural with smiling and talking. What's great about the cannula is with one little injection site, you can reach most of the treatment area, so less poking is necessary. So as I usually do, I use my non-treatment finger to make sure I know exactly where the tip of the cannula is, so that I know exactly where the filler is being placed. And I just apply tiny bits as I go while I'm looking at the skin to make sure everything is going as planned. You can see the results immediately, which is why I love filler so much. Usually you just have a day or two of a little bit of puffiness, a little bit of redness that settles very quickly. How you doing? All right. The filler is mixed with a little bit of lidocaine, which is good. In this area, for about 20 minutes after the treatment, it can kind of feel like you had a minor dental procedure, but that sense of numbness around the mouth will go away very quickly. You can put makeup on right away. I generally recommend icing on and off for the next couple hours. Avoiding strenuous exercise today and keeping it simple tomorrow if possible. Avoiding things that can worsen bruising, like baby aspirin, ibuprofen, Advil, fish oil supplements. You could take Tylenol if you need to, but certainly if you have a medical condition, you should not stop any medication. She's doing great. These treatments can be done every year, something like that. They do tend to last quite a while, and just as they sort of slowly take effect, they slowly wear off. So it's something that's really easy to get done and work around everyone's busy schedule. And that's it. And just as I went in carefully, I came out very carefully with one little poke. And so then what I do is just kind of smooth out the area, make sure that there's no bumps, make sure that the filler went exactly where I want. And what we'll do is hold a little bit of pressure on this side, and then you can tell that this area, I was pinching before and it would buckle, so now it's completely flat, no more volume loss. And so we'll come around and we'll do this side. Thank you. one side. Now I'm going to go ahead and do her right side. So first, I'm going to put the little numbing dot, just like before.
Do you want to show them right back?
Oh, yes. First,
Because they're close.
okay, yes. So a lot of times when somebody is at rest, you feel like they definitely don't need any filler. But when you smile, a lot of patients start to get bothered by these little lines. So you can relax. And then what I do to check exactly where the volume is needed, if you pinch the skin, you can see where the skin puckers, and that's where the volume loss is. So you can really highlight that even when they're not smiling. Okay, so you can rest back. All right. There we go. A little poke. 1, 2, 3. And then I just do my little introducer needle, which is a 20 gauge. And then I'm using the 25 gauge 1.5" TSK cannula. It's just the one that I like using the most. I started off using a 27 gauge, but I find that a 25 gauge is even easier because it's a little bit stiffer, and I know exactly where the tip of the cannula is at all times. So I kind of am very gentle passing the cannula through the skin. You don't want to press very hard. If you encounter any resistance, you can just redirect, and I kind of use this little twisting motion to gently move through the skin to decrease any amount of tissue trauma. And then I'm using my non-dominant index finger to feel exactly where the filler is going in. I put little tiny aliquots in each place, less than 0.01. Filler happens to be one of my favorite treatments to do because when done well, it can really make a very natural looking difference. I think what people are nervous about is that there's a lot of bad filler walking around, and so it gives filler a bad name, but there's actually a lot of good filler walking around too. You just don't know it because you can't tell that somebody's had it done. That's our goal here. That's it, perfect. So I'll just wipe off that area. So I was able to treat all of that area with just one poke on each side. That's the best part about using the cannula.